Hi, this is Dr. Johnny Nelson at Raleigh Upper X in the Bone and Joint Surgery Clinic, and this video is about what to expect on the day of shoulder replacement surgery. So you may be thinking about, or you've already made the decision to move forward, or you may be scheduled already for shoulder replacement surgery. And if so, this video is meant to tell you a little bit about what's going to happen on the day of your shoulder replacement surgery. So most important thing I want to go through first is that before surgery, and every patient will get a copy of this, I do want you, in your packet that you will receive, is going to talk about Tylenol before surgery, right? So studies have shown us that patients who take Tylenol in the 24 hours leading up to their surgery, so before their surgery, 3 doses of Tylenol, studies have shown us that those patients have less pain after the surgery, right? So even if Tylenol doesn't really do anything for you, even if you feel like it doesn't work for you, it has this effect on patients that if you take it before the surgery, it says typically 1,000 milligrams, 3 doses, so 1,000 milligrams every 8 hours times 3 doses, and the last dose being right before you leave your house to go and have your surgery, right? So that's going to be in your surgery packet. So that's one important thing to understand about the date of surgery. The other thing to understand about shoulder replacement surgery is kind of where it's performed. Now, sometimes shoulder replacement surgery is done at a surgery center, which is sort of like a small hospital, but usually patients go home after their surgery from a surgery center. Sometimes it's done at a hospital, and at this point, a lot of my shoulder replacement surgeries are done at a hospital, and mainly because these tend to be a little bit bigger surgeries, need more complex instruments and things like that. And also, every once in a while, a patient will stay home, or stay in the hospital rather, after the surgery to heal. Okay, so while we try our best to send patients home if they're able to do so on the day of surgery, and most patients do, some patients do stay overnight for monitoring after the anesthesia, if they have other health issues and things like that. But it's very, very rare for patients to stay any longer than that overnight. So sometimes shoulder replacement surgery is what's called inpatient, and sometimes it's called outpatient, meaning they come the same day. But you need to understand that about shoulder replacement surgery. So you will need somebody, obviously, if you're planning on going home and going home that day, you will need somebody to drive you home from the hospital and to be there with you for 24 hours after the surgery. So that's really important to understand as well. Now, the day before your surgery, or maybe 2 days before your surgery, you will get a phone call from either the hospital or surgery center where your surgery will be performed, and they're going to tell you all the details you need. So keep your phone on. So it's going to tell you where to park, what to wear, when to stop eating, jewelry, what to do with that, what time to show up. So all those details are going to go over and make sure you understand that fully. So expect that phone call in a day or two before the surgery. Now, when you arrive and you check in at the site, typically you're going to have a little bit of paperwork that you'll probably have to fill out. But after that, you're going to go to what's called the preoperative area, the pre-op area. And the main thing to understand about this is that you're going to get a lot of questions from a lot of different people, and some of those may be repetitive. I want you to be patient with this. It's a culture of safety, and we understand that the more there are different people that are asking you and confirming with you what the plan is and things about your medical history and things about the surgery, the less likely we are to make mistakes on things. And so please be patient with that and expect that. After that, 2 doctors will see you. Number 1, the anesthesia doctor will see you. And that anesthesia doctor is going to be going over the anesthesia plan for you, okay? Usually for shoulder replacement surgeries, the anesthesia is 2 different things. Number 1, they're going to be doing a nerve block, okay? The nerve block is not absolutely necessary, but most of the time we do these under a nerve block surgery, and that includes the anesthesia doctor who will inject some medications around the big nerves right here at the base of your neck that will numb your shoulder and your entire arm. Not only will that keep you comfortable during the surgery, but it also will keep you comfortable at home while you're healing in the first few days after surgery. So keep that in mind. The anesthesia doctor will also talk to you about the risks of that as well, and you will make that decision with them at the time of surgery. The other thing about anesthesia is going to be an IV, right? So most patients that have a shoulder replacement surgery don't need a tube down their throat. That still is necessary sometimes, but most patients just have an IV put in their other arm where we're not doing the surgery, and through that IV they'll get some special medications that make you sleepy. So you'll basically be napping during the surgery. No tube down the throat. It's almost like you're napping. You're breathing on your own, but your eyes are closed. You're you're not aware of what's going on, and that's the two things. So nerve block on the arm that's being operated on, and then you'll have an IV in the other arm that will make you sleepy. You'll get I will typically see you there as well. So in addition to the anesthesia doctor, I'm going to come and see you. And of course, I'm going to make sure that I have the documentation on what we're doing for you. I'm going to confirm that plan with you personally. I'm going to mark the arm, make sure you have any, that I answer any questions that you may have about what we're doing and what the plan is, just so that we're all on the same page about everything, right? Because my goal is to make this whole process as fruitful and as easy and as enjoyable as possible, to improve your quality of life. And that's my job as your surgeon and as your physician, is to answer those questions for you. And that includes up to that point right there, right before surgery. If you have questions, if you have concerns, right, you got to bring those up to me, and I will do my best to answer those. And sometimes that means calming those fears that you may have right before the surgery. But I will definitely see you then. So from there, you will go back to the operating room, and I won't go into too much detail. I have other videos about exactly what we do during the shoulder replacement surgery. We go back to the operating room, and we put you in a special chair, right? Your head will be kind of padded in a little special holder. You're going to get that sleepy medicine. We clean your arm up really well, including where we're going to be working, and I do the procedure, right? Now, when you come out from the procedure, you will typically have two things on your arm. Number one is you'll have a dressing on the front of your shoulder. So consult a separate video that I have called Healing After Shoulder Replacement Surgery to know more about that dressing, but that dressing will be there. The other thing is you will have the sling on your arm. So that sling is meant to be a reminder for you and for others not to use your arm, and also just to kind of help cradle and hold that arm while it's healing, right? And so those two things will be on you when you come out, and you'll go to what's called a post-anesthesia area, also called a PACU, and the nurses are just going to make sure you're waking up okay, that your vital signs are good. They usually give you something to eat or drink after the surgery, and then your family will be able to come back and see you, or your support person will be able to come back and see you. So that's about it. And from there, patients will either go to a hospital room if they're staying overnight, or they will be discharged home. The nurses will go over everything with you to make sure that you understand what you can and can't do, that you understand your wound care, that you understand your sling, if you have a polar care, how to use that. So they'll be answering a lot of your questions, and if they have questions they don't understand, then they're going to contact me about that. But they're going to go over everything from your medications when you get home, to your prescription for your pain control, to your wound care. So hopefully this video was helpful to kind of understand you, to help you understand what to expect on the day of shoulder replacement surgery. If you have any other questions, of course, reach out to me, talk to me on the day of the pre-op visit, or give us a call. But from Johnny Nelson and Raleigh Upper X Bone and Joint Surgery Clinic, take care. Hope you're well.